Hello and welcome back to the channel. We're going to continue our series on when and where and how to get mental health treatment. Mentally Speaking with Dr. JB, which will be, I think, I'm not sure if I'm just naming this series that or that's just like what all of the series that we're having is going to be. Actually, now to think about it, that, don't even make sense. So, mentally speaking with Dr. JB are going to be my mental health components, but I think it might make more sense, and it's going to make more sense when I do in the playlists because this is the last of the whole series. So, thank you guys for making it to this far. If you were here from the start, drop it in the comment. Like I saw all these lectures. I watched all of them. I am here. I want to know who you are and thank you. But yes, so I'll do some more organization with the playlist where it'll be this mentally speak with Dr. JB dash. I just might make that the name of this course or name it something else, and then do mentally speak with Dr. JB dash burnout because that's coming up next. Hey, at the request of a very valued viewer. That will be coming up next. Burnout. We're gonna have grief. Did not forget about my ADHD series. That's gonna happen, and I'll probably go through nooks and crannies of CBT, motivational, what have you for different diagnoses. We are in it for the long haul, or as long as I want to do this. But for right now, we at least got 3 lectures coming up. So stick with me. All right. So not lectures, series coming up. Lecture series coming up. And okay, let me rephrase. This is the last lecture of the lecture series. And the next live after this, which I'm so excited about, is going to be a quiz. Yes, a quiz. And then apparently you could do quizzes on YouTube. So I'm gonna play with that. I don't even know how that works, what that means, but I'm excited. Like I am pumped. I don't even know. Like I think I should just make that a regular video for that feature. But I am like pumped to like make quizzes. So at the end of all of this, or I might even be able to post it even before. Just look out for the quiz. The quiz is coming. So excited. So excited for the quiz. So the quiz is coming, and yeah. So this is the last lecture of this part 2 and of the whole series. So thank you for being here. But let me just recap a little bit. In the first part of the lecture series, where we discuss when to get or when to recommend someone get some help, we just went through diagnoses. Not for you to self-diagnose, not for you to self-diagnose, for you to diagnose someone else, but for you to have like, oh, snaps, that's a reason to get treatments. We talked about depression, anxiety, OCD, substance abuse, personality disorders, eating disorders, ADHD, so many things. We talked about so many things. So go back, look at that. It's going to be a resource. Things change, throughout, but for the most part, those will kind of be some tried and trues of like, okay, those are things to look for. Or for the least, these are like warning signs of like, maybe I should get help, or maybe I should recommend someone find help from someone else. And now we're in the how do we get help section, where early in this series we talked about how to get help, so resources that you can use to get help. We talked about therapy versus medications. We talked about types of therapy. We talked about side effects of medications, when to use medications. So we have a plenty of material, which is why I am so excited about this series. And like this series and other series, the plan will be that the lives will be up. But if you want just the bread and butter, just the content, or mostly just the content, I have a Patreon where I'll be posting that edited content, and then I also have a Udemy page where I'll be breaking up these series into courses, and they will be available on the Udemy page as courses that you can purchase. So you can support me in a gamut of ways, but thank you again for being here. Subscribers, really important so that I can maximize YouTube, that this reaches more people, because it's important. Like, it's important that people know what to look for and how to get help. Like, it's so important. So just share this, like, subscribe. It helps other people find it. So I just thank you so much. And this is previously recorded. So if you are watching it when it premieres on the live, I will be on that live too, and I'll be chatting it up, and I'll be available to answer questions that I seem are appropriate, or that I can answer at that time. I can't promise that I'll answer all questions. And then even afterwards, this is a living thing. That's why I love YouTube, Facebook, what have you. They allow us to not only to not only put this content out live or put out evergreen content, but it's because it's evergreen, it'll be here. So we could continue this conversation, continue to share, continue to help others. And the good thing about this lecture, and probably for the other lectures, I don't feel like they'll age that much, or they'll age gracefully. Like, it's not as if like anything I'm presenting is going to be like not applicable probably in the next who knows years. So continue to share, continue to support. Thank you so much for people that have supported thus far. And let us get started. So if you have done any lectures with me so far, you would know that we always have the thing in quotation, the thing in quotations, which is what should I expect? All right. So what should I expect would be what we call the chief complaint, or what somebody would ask in regards to what the topic is. So what should I expect? This is a discussion about the emergency department and inpatient treatment. So let's back up a little bit before we even get to the emergency department or the ER emergency room. Before we even got to that point, the purpose of everything in the course before is so that you can get help when you see the warning signs before it gets to this point. So it's almost akin to getting help for that scratch before it starts getting red, before it starts getting infected, before it starts getting gangrene, and before it becomes dead tissue and needs to be taken out and you have to get surgery. So the point of everything before this lecture is to see the warning signs, adhere to them, get help before it has to get to this. Now, sometimes things go from 0 to bajillion. I understand that. But for most people, there are steps before we got to this point where we need an emergency department or emergency room visit. And if we could prevent that, that's the point. But let's say we're there. Here are some reasons why you would need, or someone would need, to go to the emergency department, and why we'd have to call for them to go emergently. So the reasons could be the person is suicidal, and they have thoughts of killing themselves. They have tried to kill themselves. They deeply want to kill themselves or hurt themselves. They really want to hurt themselves. They have thoughts of hurting themselves. And it's on the level of we need emergent help that they aren't able to receive in an outpatient setting, or is beyond the scope of an outpatient setting or office setting. Then there's homicidal thoughts. And these homicidal thoughts are not just, I want to kill somebody necessarily, but homicidal thoughts related to something psychiatric. And let me reemphasize that having a psychiatric diagnosis does not make you more violent inherently. Inherently, violence does not equal a diagnosis. A diagnosis does not equal violent. It's not even a symptom of, I don't think of anything other than maybe being antisocial, but psychiatric illness, psychiatric diagnosis, psychiatric disorder does not equal violence and homicidality, but sometimes this can happen as a result of someone who is in a very dire state in their illness or diagnosis or disorder. Then there's unable to function because of psychiatric symptoms. Now, if anyone is able to function because of any symptom, whether it be psychiatric or medical, you should be going to a hospital regardless. So when I say unable to function, this isn't just like, oh, they're not able to hold a job. That's not a reason. We're saying like this person can't eat, this person cannot sleep, this person is just not maintaining daily functions on their own. They are not thriving, not in the sense of like they live in their best life. They're not living a life at all. So unable to function, or just symptoms are just so bad or so severe that they're not able to do anything, or that everything in their life is kind of just falling apart and impaired, that might be a reason to go to the emergency department as well. And also, let's say you don't meet those 3 criteria. There's always, let's say you have an alcohol use disorder, or you're on some type of other drug and you want to safely detox or start rehab. Emergency department might be your point of contact into safely detoxing or getting into a rehab facility. Now, there's 2 things to think about is that once you go into the emergency department, whether you went there against your will or you went there willingly, you may be sent there willingly or against your will. So you could drive there, you go yourself, or you could say, I'm going myself, like I'm volunteering to go to the emergency department. And even if they take you to ambulance, you say, I'm agreeing to this. Or someone could call on you, or you could call on yourself and say, I'm okay, and still involuntarily go. So just to know that it can be voluntary or involuntary. Yes, you can go against your will, especially if suicidality or homicidality are at play. Usually you're going, whether you want to or not. And even for unable to function, you're going whether you want to or not in some cases. Now, what to expect? So when you're at the psychiatric facility, sometimes this could be a crisis center, or sometimes this could be an area in the emergency department or its own facility. There'll be certain safety protocols. Taking away your phone, putting you in their clothes, taking away anything, basically all your belongings put away, you wear their clothes. That's usually the protocol. Don't fight them about it. Don't give them a hard time. They're not doing it just to give you a hard time. They're literally doing not only to keep you safe, but to keep everybody safe, because everyone there is there for different reasons and we want everybody to be safe. So that's why we call it safety protocols, not just in infringement on your rights and your things. So safety protocols is there to keep you safe. So you get there, someone will evaluate you. You may be evaluated many times. Guess what? You're going to have to tell that story maybe at least 2 to 3 times. 1 time is a luxury, and I doubt you have it. So just get ready to be talking a lot to a lot of people about the same thing. That's what happens, because they need to know, do you need to stay here or do you need to go? That's really the purpose of the emergency department. Going or leaving, just like any emergency department, whether you're there for a broken leg, diarrhea, vomiting, needing surgery. Are we keeping them? Are they staying? That's what we there for. So they might ask you a bunch of questions, a bunch of different people, but essentially that's what they want to know. They may offer you medications. Sometimes this could be against your will if you're violent or just not functioning, or you can't sleep, or you're just so anxious you can't even participate. They may give you medications, sometimes on your will or against your will. There might be brief therapy interactions. Sometimes there'll be somebody there to give some brief therapy, but nothing kind of ongoing or nothing really in depth. Let's say they let you leave. They're like, no, you don't need to stay. You don't need to go to an inpatient unit, or you don't need inpatient detox. They'll give you resources and follow up. If they don't, they need to, because that's really important. So if somehow that's missing, say, hey, do you have any resources, any follow-up materials? Ask them about that, because once you got to the point where it was even a thought that you should be there, Just ask for those materials. And then possible admission to a psychiatric inpatient unit. So let's talk about what that is. What is inpatient treatment? So essentially, this could be a gamut of things. This could be an overnight stay, depending on what type of room you're in. It could just be an overnight stay in the emergency department. That can count as inpatient treatment. This could be in a hospital room or a hospital wing. That can count as inpatient treatment. Or you could be in a closed unit that's kind of barred off from everywhere, where you can't go in or out. That could also be considered inpatient treatment. So what do I expect in these type of things? Once again, we have these safety protocols, we have these rules, we have these visiting hours, we have these things just to keep order and to keep everybody safe. Because remember, everyone is there for a different reason. And we want to keep everyone safe, and that's why these protocols are there. They are maybe annoying. They may be feeling like the worst thing ever, but trust me, they are there for you more than it is for the people making the protocols. It's there for everybody to help both the providers and also the patients. Evaluation. Once you get on the unit, they're going to ask you the same questions again. And not just them, the nurse, this one, that one, the medicals. There's gonna be a lot of questioning again. So just know that that's a possibility. What should be happening is there should be a daily visit with a psychiatrist or a medication provider. They also have individual therapy on the unit. They have groups on the unit, so group therapy. There's usually therapeutic activities. To this day, I still have a painting that a patient made for me while she was on the inpatient unit. And so there's activities. Sometimes there's religious activities. Sometimes there's arts and crafts, music, therapy dogs, what have you. There are activities. And then there are, when you've completed the treatment, there are outpatient resources, and you should get a follow-up. You need to get a follow-up after you leave an inpatient visit. There have to be some type of follow-up put in place. It might just be follow-up at a certain place, or most places, there's a place they want you to go with an appointment. Now, what I want to put is not just what to expect, but what is the point of this? The point of an inpatient stay is for you to be stabilized. It's not to cure the person. It's not to solve all that person's problems. It's not to help them get housing or get this or get into that. The real purpose of an inpatient stay is to stabilize that person, to help them be no longer suicidal until they're no longer homicidal, or until they're able to care for themselves. And this is not the order of like weeks. Normally, the goal of this is on the order of days, preferably 3 to 5 days. And then the rest happens either at an outpatient facility or a step down, which might be partial hospitalization, where they still see someone or have this level, but they go home, right? But the purpose is not for you to stay there indefinitely or for weeks. Although some people may feel like they were kept there, I can't speak towards the philosophy of a specific unit, but I know overall, the goal is to get the person in, get the person stabilized, and get them out. The real work doesn't happen in the inpatient unit. The real work, sometimes the inpatient unit is used to get the ball started, but the real work happens in the outpatient setting. Even if it's like intensive outpatient or even a residential program where you are kind of supervised more, or even at a doctor's office, that's where the real work happens. Ideally, we don't want you to stay in the hospital or inpatient unit. We want you out and living. That is the point. Now, I understand. I've heard mixed messages. And that makes sense, because all inpatient units are not created equally. All emergency departments are not created equally. What I can say is the main goals are to stabilize and to prevent suicidality, homicidality, and to also help people be able to function. So let's talk about some of the negative things. Just get it out. in the open of negative things that people find it hard to reconcile with, and even I would find hard to reconcile with if I was in this situation. It feels forced. A lot of your rights can be taken away. This is not taken lightly. So in certain states or certain places more than others, there are more rules around who can be committed against their will and who can't. Let's not forget there's other patients. You might be there for something that you may perceive or may actually be less severe, and there are people that are really struggling, and y'all are roommates or y'all are in the same unit. That can happen. And then, although I talk about the timing of it, some people feel it was too fast. I wasn't ready to leave. And they just kicked me out. That can also be a negative experience with just a wide range of other things. But I don't want you to let other people's negative experiences get in the way of the whole purpose, which is you're there for suicidality, homicidality, or not being able to care for yourself. These are serious things. And in addition to helping you with these serious things, some people have had positive experiences. Some people have found it to be extremely supportive. It's a supportive environment in which they were able to start finding community with the things that they're struggling with. Some people found it as a time to reflect. No, it's not vacation. But sometimes that break, it may not sound like a break, but for some people, that ability to make sure that they're sleeping, that ability to make sure that they're not around negative influences, that ability to make sure that they're in a controlled environment actually helped them and gave them a time to reflect and a time to heal. Moreover, it was a safe place. Some people are doing so unwell. They can't even look in their house without thinking of ways to hurt themselves. They needed that safe place. That same place that people felt that people may feel is too constraining is a holding place, a safe place where people can be able to get treatment while also not be afraid that they will even hurt themselves. And then another thing is that a lot of times, because you were in this environment, follow-up was quick. When you were calling all that time before, you couldn't get anyone, you couldn't get any help, so you ended up in this position. Guess what? They expedite follow-up for people that were in an inpatient unit. Now, granted, I do want to make a caveat before we end this, is that there is a possibility that although you may feel like you need to be hospitalized, the providers there may say no. And although you may feel you don't need to be hospitalized, the providers may say yes. It's a very precarious situation at times. So that's why I want to emphasize that as the end of this lecture, to go back to the beginning, that you want to get that early identification. You want to get that outpatient help. You want to get that outpatient community. You want to get those resources. You want to get that mindfulness, that exercise, that meditation, that nutrition down pat so that we don't even get to this point. Sometimes we can't control getting to this point and help is there, but that's the point. The other thing is that just like you don't have to feel like you have to go to a certain office for therapy or medication management. If you present voluntarily somewhere, you don't have to go to any old hospital. If you feel like you're getting to that point where you're like, I think I might need to go to the hospital, and you have that insight, look up some good places before you just get sent to the closest place. And sometimes we don't have a choice and you have to go to the closest place. You got to do what you have to do. You got to make do. They're not going to transfer you. So really, the earlier you can identify when help is needed, a crisis is happening, I'm nearing the edge, the more options you have. Because by the time you get to the emergency department, a lot of those options kind of fall to the wayside. But even then, I want you to stay informed. I want you to read the forms that they give you to the best of your ability if you can. I want you to know what the medications are that they're giving you. I want you to engage in the therapy, engage in your treatment. But the earlier down the line you start to get help, it won't get to this point. So I just want to bow. Thank you for getting to the end. Woo! Of this course. Thank you so much. Thank you for everyone that has subscribed. If you found this helpful, please jot down in the comments. I want feedback. I want questions. I'm just so happy to be able to share this with more people, more learners in this type of format. Don't forget you can share these with anyone. Share this with your friends, your community members, your family, social media. Share, share, share. And if you're like, oh, I like this, but I want it just more concise, more to the point, Patreon is getting activated, or it is activated, but Patreon content is coming up on there, and I'll be updating it regularly and putting more lectures that are updated so that it'll be this. This is the content, but we won't have the forward. Oh, I want you to see me. I'm doing the most in it. I mean, I do want you to say thank you, right? It won't have the beginning and the end and the pauses I'll take most of that out. So if you want lecture, you want this but concise and to the point, Patreon, but also it's also going to be on my Udemy course. You can get the Udemy course now because the Udemy course also has all this material, but the 2026 update, which has all these lectures, that's going to be slowly rolling out. So if you buy it, you'll get those updates as well. So thank you for supporting me, but don't forget, you could like, subscribe, comment to help the channel grow and so that other people can see me. I can help more people. You can help more people. You can share. Patreon, Udemy, you name it. Thank you. Thank you so much. And the next one is going to be a quiz. I'm about to troubleshoot how to do that right now so that it can be more interactive than just click into the next slide. So I'm really excited about that. And I will see you guys soon.